Hello everyone, this is the bone video for the axial skeleton. In this video we will be covering what is the skull, the thoracic cage, and the vertebra. Let's begin. First, the cranial bones. With the cranial bones we have in the skull the temporal bone, the two parietal bones, and then the occipital bone. In the occipital we have this occipital protuberance, the external occipital protuberance. What this is for ligament attachment. With this ligament attachment we are able to keep our head upright and able to do the movement. Next we have the temporal mandibular joint that is located here. This is the joint that connects the mandible to the temporal bone. The styloid process, that would be, the styloid process would be somewhere in here, but we will show it here in the textbook. The styloid process is here, this little thing that pops out here. The next one is the external acoustic meatus. This external acoustic meatus would be here, this little notch in there, and then your squamous part. The squamous part would be here. Next, the internal view. Since we can't do the internal view with our skeleton here, we will be looking at it again at the textbook. The petrous part of the temporal bones, the question here is what is housed within the temporal bones, which would be here inside the petrous part. This part houses the middle and internal ear cavities, which contain sensory receptors for hearing and balance. In the internal acoustic meatus, which we would remember is this here, this transmits cranial nerve number 7 and 8. This is for hearing. Next we will look at the sphenoid. Let me just turn the page here. This is an excellent picture of the sphenoid, and in the textbook it shows both your superior view and your posterior view. The internal view, the superior orbital fissure. The question here is what passes through this opening. It allows for cranial nerves 3, 4, and 6 to enter the orbits of the eye. These control the eye movements. That would be for the external view. For the internal view, we have the lesser wing, which is here, these right here. The greater wing, which are these bigger ones here. The optic canal. The question is here what passes through this opening. That would be optic nerves number 2. And the sella turcica. What structure sits in the fossa of the sella turcica? That would be your pituitary gland, and that would be right in here. Moving on, your ethmoid. The ethmoid, which would be this funny looking little bone here. The internal view, the crista galli. What does this do? This helps secure the brain in the cranial cavity by attaching to the dura mater. The dura mater is the tissue that covers the brain. So this allows for, here the crista galli allows for the attachment. The cribriform plate. The cribriform plate, the question is what passes through the holes. The cribriform foramina allows filaments of the olfactory nerves to pass from the smell receptors in the nasal cavities to the brain. So that would be in the cribriform here. The sutures. So let's go back to our skeleton. The sutures here, what these sutures are, they help the skull bones articulate to each other. First, you have your coronal. Your coronal would be here. This attaches the frontal to the two parietal. Next, you would have your sagittal. Let's move this here, which would be down this area. This connects both the two parietal. Your lambdoid, which would be this here. This connects your occipital with your two parietal. And your squamous, which would be in this area here. The squamous, you would see it here. This would connect the parietal with your temporal. Next, for the facial bones, and I am having some issues here. Let me just fix this. Okay. So the facial bones, we will go back to the textbook. Let me get my notes here. 203. So in here on this wonderful colored page of the textbook, we have an excellent view of our facial bones. We have first our maxilla, which is this purple here, the nasal cavity, which is here, first with the maxilla, I forgot to cover the alveolar process, which would be here on both the mandible and the maxilla. This is where your teeth connect to the bone structure. The zygomatic, what two bones form the zygomatic arch? That would be here. That would be your ethmoid and, oh, I'm sorry, wrong. The zygomatic process would be both the zygomatic process and the zygomatic bone. Your ethmoid, which you can't clearly see, but it is back here. The vomer, what two bones form the bony nasal septum? That would be your ethmoid and your vomer. The inferior nasal concha, or concha, that would be here. These little green things, not sure if you can see it through here. The mandible is this orange here. Next, I will be showing you the body of the mandible, so we're gonna flip pages here so we can get a better view. This is your mandible here, the body of the mandible here, the angle would be here, the ramus is this here, mandibular condyle is here, your notch is this here, this swoop, and your coronoid process is this little protuberance here. The vertebral column is next. So on our skeleton, let's turn him around. That would be here, and also from the side profile, so you can see the curvature of it. Let's see. So for the vertebral column, it says point out the four curves of the adult vertebral column. The four would be the cervical curve here, the thoracic curve here, the lumbar curve here, and then lastly the sacral curve, which is down here. Your cervical curve would be a secondary, your thoracic curve would be a primary, your lumbar curve would be a secondary, and your sacral curve would be a primary. For cervical vertebra, we have 7. So from C1 to C7. The atlas. So the atlas would be the first one. What does this bone articulate from the superior aspect? what does this bone articulate from the superior aspect? The occipital condyle. It says demonstrate the motion on yourself that this joint, what this joint allows. So it would allow for the nodding. Unfortunately, with our skeleton can't do it very well. So with me, that would be yes. Next, what is unique about the transverse process of the cervical vertebrae compared to those of thoracic and lumbar vertebrae? They have the foramina to allow passage of the spinal nerves. These are the only vertebrae that do that. So the thoracic vertebra, there are 12. So after C7, you would begin with T1 all the way to T12. Let's see here. Point out the following. It says the spinous process. So let me actually get a better view for you. Again, on my textbook. Let's see here. So here on our textbook, the spinous, here, spinous process, the transverse process, which would be this little hole here, the invertebral foramen, it says what passes through this foramina, spinal nerves, so the foramen here, body or the centrum, which would be this part here, here, and the position of the invertebral disc that I can show here would be here. The disc would be between the two bodies. On our little skeleton, I don't know if you can see it, but this would be a body, and in here would be the discs, but not very clear. So next would be your lumbar vertebra, which would be the ones we were just pointing at here. There are 5 lumbar vertebrae. The sacrum, it says how many vertebrae are fused to form this bone. That would be 5 vertebrae are fused, and then your coccyx would be here, and then it says how many 4 are fused for this one. Sternum, so let's go back. So our sternum is this thing here. So on the sternum, let's go from above, or from superior to, from superiorly we have the jugular notch, then we have the, right here, the clavicular notch. Let me get my notes, I'm sorry. The manubrium, which would be in this area here, the manubrium. The xiphoid process would be here. The jugular notch, like I already demonstrated, here. Ribs, let's see here. So for the ribs, we will point out the true ribs, the false ribs, and the floating ribs, which are also known as vertebrosternal, vertebrochondral, and vertebral. Okay. So your true ribs are ribs 1 through 7. Your false ribs would be 8 through 12, and that would be including your floating ribs. It says to demonstrate the head, neck, and tubercle of a rib, and explain how ribs articulate to the vertebra. Well, let's explain how they articulate to the vertebra first. Here, they actually articulate through 2 facets. One, they connect with the same numbered thoracic vertebra, and then the second facet would actually connect to the body of a vertebra immediately superior. So they would connect to their own vertebra, and then there's a facet or joint that connects to the one above it. That's how they articulate. So let's explain the body of the rib. So let's look at the textbook again because it has a better picture. So we will point out the head, the head on here on this picture, the head, the neck, the tubercle here, and then we already explained. So this picture here is better, and it does have it here, but you can't clearly see the joints. And that is it for our video of the axial skeleton. Hope you enjoyed it.